Hello, world. My next guest was formerly a rocket scientist turned VP marketing, and what can I say? She likes numbers and creative ideas. This is why she's at Veyo, a company revolutionizing non-emergency medical transportation with a technology-first approach to helping millions of Medicaid beneficiaries who lack access to reliable and affordable non-emergency transportation have transport, which for so long for them was such a serious barrier to receiving medical treatment. We're so lucky to be with such a brilliant mind today, and here to speak about it all is Sarah Kuntsal, VP Marketing at Veyo. Sarah, are you ready to get radically transparent with me?
I'm ready, Jen. Let's do it.
Amazing. So listen, I have a bunch of questions for you when it comes to technology and what you're up to. But knowing that you have quite a unique background, as I dug a little further on your LinkedIn profile and Google, would you be able to give us a brief look at your professional journey and how you actually found yourself, one, in marketing and two, at Veyo?
Sure. Yeah, definitely. As you said, it's a bit of an unconventional past. Growing up, I still am, but I was obsessed with cars. I loved cars. When I was like 10, I was getting Car and Driver magazine. That was my jam. And so in high school, trying to figure out what I wanted to do, aerospace engineering had, thermodynamics and all these things about cars. And I was like, that's my thing. So I graduated with a degree in it, and I worked for a couple years as an engineer. I enjoyed it. It's not the most creative thing. You can't really just go off script there. And so decided to mix it up after a few years and go to business school. And in business school, really got to learn a little bit of everything: marketing, finance. I ended up in finance because I love numbers and data. But once I graduated, I kind of had this, we'll call it an epiphany. And I was like, do I want to get back into another industry with spreadsheets and numbers and no creativity? And the answer was really no. And so I was up in San Francisco and started looking around, and it was right when social media was becoming a thing for companies and nobody knew what they were doing. I got into the ad agency world, worked with several brands, helping them get set up on social media, helping them get their Twitter handles and their tags and whatever it might be, working with some of the first celebrities, a little Kardashian history there.
Really?
But yeah, just lots of fun kind of figuring out, like, what do we do on social? How do we interact with people? Who's going to read this? And then worked there for a couple years, and really enjoyed it. Worked across, fashion brands, automotive, healthcare, a little bit of everything. And then moved back to San Diego, which is where I'm from, and ran across this little company that wasn't even called Veyo at the time. And they were kind of going up against Uber back in the day. And I was like, this seems like a fun challenge. Let's see what we can do. And so that's how I got to Veyo.
I think that's a really fascinating journey. And what I find even more fascinating about it is today's modern day marketer, you almost need to really have both sides of that brain, right? Where you're able to think analytically, but also be creative. And I think, the evolution of marketing, if you will, when it was the days where you would just post up a billboard, I think marketing had this connotation where you needed to be super creative, call in the marketers, we need creativity. But today, it's almost completely changed in that you need to be data driven. So your background couldn't be more of a perfect fit, I think, to be a successful marketer. And that leads me into my next question about Veyo. And I know, we've spoken in the past, and you had shared with me some pretty phenomenal stories about what Veyo is up to and what you're doing from a marketing capacity, but also from an organizational capacity. And I was wondering if you could share with us what is the value that Veyo is bringing to your customers, and a little bit about the business model, just so people can get a true feel of how you guys are truly revolutionizing the healthcare industry when it comes to transportation.
Sure. Yeah, yeah. It's been very interesting. So as I mentioned, when I started 7, 8 years ago, Veyo didn't exist. We were doing kind of the similar transportation, like an Uber dispatching thing on the consumer side. And the company that we worked with did this NEMT in healthcare. And so NEMT is basically non-emergency medical transportation, and it's at the core, it's just getting people to and from healthcare appointments. Whatever those appointments might be, it could be, an annual checkup, it could be dialysis, it could be chemotherapy, it kind of anything to do in general with health. Um, and so it's been done for quite a while, for 30, 40 years now, in a very old school way. So lots of like fax machines, lots of, think of like big 15 passenger vans picking up a bunch of different people and taking them to like a health center. And then 6 hours later, taking them all home. So it was these long, full day adventures for these people that are trying to get to just the doctor, whatever it might be. And so we kind of looked at it and said, hey, like there's all this great new technology on the consumer side. There's the Uber app, there's tracking, there's, all these companies coming out. And we have a very similar thing happening on the healthcare side with no innovation. So the idea was like, let's take all this great innovation and move it to healthcare. And so what Veyo does is we partner with large health plans or state agencies. Like sometimes if a state runs the Medicaid plan, we partner with them. And then we manage the transportation benefit for them. So in the same way that you would get a dental benefit or a vision benefit, many people on Medicare Advantage or Medicaid get a transportation benefit. And so they call us, they say, hey, I need to go to so-and-so on Wednesday at 10 a.m. I need a ride. And then our system, we make sure they're eligible according to the plan. We figure out what's the best way to transport them. Sometimes it's mileage reimbursement if they have a vehicle. Sometimes it's a public transportation if they live close to a bus. Sometimes it's sending a vehicle. And then we make sure that they get them to the appointment. We get them back. We send all that information to the plan. So it's really, in the last couple of years, there's been a lot around social determinants of health, and it's sort of everything that's outside of the doctor's office when it comes to health, like making sure someone has consistent food or housing or transportation, because without those things, like you're not going to get to the doctor's office, you're not going to get better. And the real idea is that it's, a $10 or $20 bus pass or trip is a lot cheaper than someone who doesn't go to the doctor often and then has a heart attack and have to go to the urgent care or the emergency room. So that's kind of the gist of it. And we've just brought a lot of awesome technology to a space that was like ridiculously old school. When you hear stories, you're like, oh, okay. So now, members can order a ride on their phone. They can get texts about their ride coming. They can track when their driver's coming. They can rate their ride. And the big thing on the health plan side is they really get to see everything. So they have previously been dealing with a lot of old school trip logs that were written and faxed. And now, they get to see all this transparent data, and they can see, oh, like Jen did get to her appointment, but she was 5 minutes early and this happened. She rated them 5 stars, whatever it might be. And so from the marketing side, there's just all this great innovation that like we can talk about and go to plans and be like, hey, you know how this is really old school? Like we got something for you. And that's the fun thing. There's like a ton of content out there on my side that I can pull from and create stuff for.
I love hearing that. And I wish we had, a full hour of an episode to dive into some of those stories, because I think, it's something so simple. It's one of those ideas where you're like thinking like, why didn't I think of that? I could have made so much money. Or like, it's just something so simple, but yet so needed. And I have to ask, because, when you say, healthcare at this time, the Delta variant flowing around, I have to ask, how has COVID-19 impacted this industry, if at all? Or has it had, an effect where you're actually making lemonade out of some of those lemons?
We are making lemonade, but there's a lot of lemons. I mean, I don't know if there's an industry that hasn't been impacted by COVID. I think it's just touched everything in some way or another. And so for us, like you mentioned, it's all these healthcare trips, right? And so the good thing is that for us, is a lot of these trips are required. Like if someone has to go to dialysis 3 times a week, we can't just be like, oh, sorry, nope. And the dialysis can't just close. Like this has to continue. So a lot of what it's been is just been kind of refocusing on like, what are the trips that have to continue? Let's make sure they continue. What trips aren't going to continue? Let's make sure those are off the system. So we're not sending drivers to someone who's like, I'm not going to the hospital. And so, for us on the marketing side as well, I manage a lot of the driver recruitment ads. And so getting those drivers in. And so during COVID, we really had to take a look back and be like, okay, like how many drivers do we still have? Because a lot of people weren't comfortable, which we understand. And then for new drivers, how do we onboard them? Like, how do we get them into the system? How do we get them interested? So it was a lot of communication and changing our messaging and making sure that people understood that, you're not going to be driving like someone who's super ill with COVID in the backseat to your car. This is someone who's taken precautions. They have to go to dialysis. They do this all the time. They're being very careful. So there was a lot of communication, getting PPE to our drivers. We did a specialized COVID-19 fleet, we called it, in 2 markets. And so we found a subset of drivers that they did a bunch of additional training on all these safety precautions and COVID precautions. They wore like full head to toe PPE. We actually had a fleet of vehicles for them that every trip after it was done was like fully and professionally cleaned for them. So, it was a lot of work of saying like anyone who might have COVID-19 or have be at risk at it, like goes on this fleet. Everyone else can go on the regular fleet. We also, we did have some extra drivers available just because in the very, very beginning, a lot of people kind of stopped doing trips. And so we worked with our health plans to see how else can we use these drivers. And a lot of them had some older members that needed to get food or PPE. And so we were delivering meal packets and PPE packets to members in 2 of our regions. So it's definitely, I think COVID has taught us to be very nimble and learn how to pivot quickly. Also, we used to do a lot of stuff in person at our driver offices, and we had to figure out how to do all of this online. So really finding new tools online and like, what's the best way. And like you said, with data and analytics, like looking through and being like, okay, no one's using this tool. Clearly it's too complicated. We do have drivers of all age types and language types, and not everyone's super comfortable just getting on tech and jumping on a Zoom. And so kind of figuring out like, okay, like we might need to call this person and have a conversation with them. And really just paying attention to the trends that we're seeing. Like we're seeing good here, what are we doing well? Bad here, what are we doing poorly, or what can we fix? And I think that's the good thing that we learned and we're still doing today, is just kind of paying attention and like, okay, we got to be quick. We can't wait like 3 months to install something new. Like, yeah, 3 days, let's do it.
I listen, I think it's such a valuable lesson to learn. And I think for so long, marketers, we kind of got into this flow of we knew it worked. We knew what time people, let's say, were reading their email or what time we would need to call someone. But I think now COVID, as you said, it's really challenged us all to kind of take a moment, pause, reflect on like the small campaigns that we're doing, fix the trouble spot, keep going, but like also take time to reflect. And I think that's critical in marketing, for lack of a better word. However, thinking about what you're sharing with me, and knowing that the industry that you're in, right, it isn't necessarily you're really transforming it. It wasn't something that technology was there and people are it's readily available and people know how to use it. So I'm sure that there's no shortage of things that also are keeping you up at night, perhaps professionally, that you'd like to share with us.
Sure. Yeah. And I think it's always the one thing I think that really keeps us all going at Veyo is like we do have an end consumer whose lives are being changed by what we do, which is great. And so, we get to hear all these great stories of, someone really being helped, or that driver just came in with the right words, the right time of day. I mean, we have some great stories where like drivers literally saved someone's life by performing CPR, or someone who was having suicidal thoughts. And she just was like, I'm going to stay with you until your mom comes, and like pretty much saved his life. And so for us, it's sort of staying up at night to be like, how do we make sure that like nobody gets left behind? Like stuff happens during the day where there's traffic or an accident or whatever. But for us, it's really like, how do we make sure we get every member picked up? COVID did change the workload a bit. There's a lot of work to do, kind of figuring out like, how do we get everything done? There's a lot from the communications, we're managing thousands of drivers and millions of members. And I think it's just prioritizing and making sure that like that member who's getting the trip is always at the top of the list. And what can we do to make sure that they get picked up and get to their appointment on time and all that good stuff.
Yeah, there definitely doesn't seem to ever be enough time in the day. I'm certainly in your boat with that. And, I want to talk a little bit about, and you can keep me honest here, but from what I understand of the non-emergency medical transportation industry, of what you've shared, because you are working with states, governments, healthcare providers, it is a bit of a regulated, perhaps even heavily regulated industry when it comes to certain areas of marketing. And I was just wondering, we do have a lot of audience members who do come from heavily regulated industries that oftentimes present a lot of challenges when it comes to marketing, whether it's, you're dealing with, GDPR and data protection, or, I'm sure in the medical, field, not sharing private information of your, the passengers of the vehicles, but yet enough to make sure that you have what you need to do what you need to do. Could you share a little bit about kind of what those challenges look like and how you're overcoming them, or kind of thought processes behind jumping over those hoops that might be able to help others in similar regulated industries?
Sure. Yeah, it's it's healthcare, so we're definitely heavily regulated, especially with HIPAA and PHI. Like the personal health information. I hope I got that right. But yeah, I think that's kind of the biggest one for us because we hear all these stories about people and we want to share them and we can't, or we have to get permission. And oftentimes we go and they're like, "I'm not going to share that story."
Yeah.
Um, I think the thing that really helps us, like we're mainly a B2B industry because we're talking to these large health plans in these states. And so I've really focused on sort of creating content versus like creating a big, expansive advertising platform.
Okay.
Um, so I think a lot of our potential partners, they know who we are. There's a lot of conferences. So a lot of what we do is really one-on-one as well. And so it's a lot of like me sitting down with the sales team or the account team being like, hey, like, what do you think those guys really want to read about or see, and what's really going to catch their eye rather than like, we're Veyo and we're here. And so for us, it's a lot of, okay, we're going to get these stories, but like, what's the best way to share them? We've really learned that plans love seeing success stories about other implementations and launches. The thing with NEMT, like, it's not a small thing to buy. You don't just like, I'm going to do NEMT. The sales process is months, if not years long. The implementation process is very long and lengthy. And so for us, for a plan, like they're just like, oh, this is a lot of work. I don't know. And so for us to be able to show them like, hey, let's focus on the content they really want and like really kind of do like one-to-one sales and marketing, like at a conference, like, hey, I have this case study that we just did. I want to show it to you. So I think we're a little lucky because we're not on the B2C side where we're trying to like share things widely. It's a lot more of like a one-to-one kind of sales process. And we're HIPAA's tricky, and we just always have to be careful. We do lots of HIPAA training with the employees and things like that. But just making sure that like, okay, we do have drivers, and we can get their permission to share stories, and then we can just leave the member part as kind of like more vague. Like we helped a member and not have that personal information there. But yeah, I would say I think our biggest thing is just really focusing on like what that end consumer is looking for and kind of working around the regulations on that rather than doing the whole big story.
Makes sense. Makes sense. And it kind of leads me into my next question because, again, with all of the regulations, and I always wonder this, oftentimes for marketers, there's just such challenges in those regulated industries. In a
Mhm.
world today where it is pretty essential for B2B companies to be on social media. And then kind of with all these buzzwords, right? Like your audience wants you to be authentic and they want you to, pave the way with authenticity, yet you're super regulated. Could you tell us a little bit about what your social media presence currently looks like and what's resonating well with your audience?
Yeah, social media is definitely tricky. And even if you Google like how does HIPAA work with social media, like no one's quite sure because HIPAA was really written and done before social media came about. There are no official rules around it, so there's a lot of recommendations. Most of those are based on like people getting in trouble, like sharing photos and videos from an ER, like not allowed. And so for us, we kind of fall back on that B2B side where like, okay, let's focus on like we have case studies with healthcare facilities that have nothing to do with the member and they're kind of the larger overall picture and we'll share those. We do, with the driver side, like we do lots of driver stories to kind of like share what it's really like to work at Veyo because it is a little different from like the Lyfts and the Ubers out there. So like let's show that in like a great content sort of story type way. And I think the hardest thing for us is just people like to go comment on social media. And so we get people commenting about their personal trips and like we can't say anything about it. We kind of just have to direct them to like HIPAA appropriate areas. So it's kind
Okay.
of just funneling people into the correct areas and focusing on things that are like very safe in the HIPAA realm is how we focus on social media.
Which would you say, for social are your strongest channels? And because B2B usually goes hand in hand with, let's say, like LinkedIn, but would you say that that's relevant for healthcare as well?
Definitely. Yeah. We definitely see a lot of activity on LinkedIn. We hear I hear from the sales team that like, oh, so and so saw this on LinkedIn. I'm like, okay, good,
Okay.
it's great. Like, so things are getting
Yeah.
out there. Facebook is definitely more the driver focus. People are random people commenting on Facebook. Twitter as well. Twitter's pretty good. I'd say Twitter and LinkedIn we kind of share like a similar focus, and then Facebook is a little bit more on like the driver side and kind
Okay.
of our B2C side, what we call that.
Makes sense. Now, listen, because I keep it real and I want to make sure we stick to our 30-minute episodes because
Okay.
someone's walking their dog right now and maybe just getting back to their home.
Yep.
I have two more questions for you. So, the first one is, and we kind of touched on it before, right? There's literally so little time in a day, and with work and home and everything kind of intertwined into one. I was curious to ask you, as a marketing leader, what have you implemented in your day that might help other marketing leaders or marketeers in the same boat either prioritize their day or prepare well for their day or just at least stay sane for an hour?
I would say I think my biggest issue is just getting distracted. Like I'm so easily like, oh, a newsletter. Like, oh, let's go. Now I'm gone for half an hour. I think the thing that's helped a lot is really to just like set firm times of like, okay, I'm gonna start working at whatever time and I'm gonna stop at whatever time. And it also just makes me like realize there's a limited amount of time to get stuff done. I think on days where I don't do that, all of a sudden it's like 8 o'clock and I'm like, oh, it's dark and I haven't eaten food in like 10 hours. And like I've been all over the internet and I got stuff done. But like, it's kind of like, okay, I have 4 hours to get these like 5 things done. I always have checklists. Like I got to get these done. And then you at least know that there's kind of like a little flagpole to go by your day. I really think that helps a lot is just kind of setting like guidelines, having it to do. I love checking things off. There's something so like cathartic about, oh, I checked it off or crossed it off. And I think that helps to be like, I got 3 more to check off in an hour. Like, let's get it done. And then I won't get all distracted by like the latest, whatever newsletter coming in.
Makes sense. It was funny because I've started to do that as well with my calendar where I've never done before, where
Yeah.
I don't have a meeting with anybody, but I've actually started blocking my calendar with action items. And it
Yes.
does help create that sense of urgency that I feel we
Yes.
all thrive under. Like, oh, the meeting's starting in 10 minutes. Oh, that's my webinar prep. And
Yeah.
then, you're kind of focused on getting it done. And I agree that when I don't block out my calendar like that, it's the same
Yeah.
shiny syndrome.
There's just so much with like a Slack pop up and then email, and all of a sudden I have like 7 things that I'm half doing, and I'm like, okay, I need to like at least get one of these done and then start checking off the other ones.
Totally, totally. Now, my last question, I think, is probably my most favorite question. And as I shared, I did do a lot of research about your background, and mainly that was done on LinkedIn. And you have a great LinkedIn profile. I have to say, if anybody is in need of like updating their profile and needing some cool ideas on how to do it, check out Sarah's profile. But I want to know at this time, what's one thing you can share with us right now that we aren't able to find out about you from LinkedIn and that we can only learn from listening to this podcast?
From listening to this podcast. Um, so this is so nerdy. I'm a big book nerd. I love mysteries of all sorts. I think the thing that like not many people know, like I love mysteries, but I also really love cozy mysteries, which is like a subset of mysteries, which are like
Okay.
think of like old school Agatha Christie or like Murder She Wrote, where like it's in a small town and like maybe the cat talks and like there's some like, but like I'm like a sucker for like a nerdy mystery that has some sort of like maybe weird sci-fi or like maybe some old lady doing the mystery solving. So if anyone needs recommendations on, cozy mysteries, I got you here.
Give us one to get started. What's one of your favorites or one you're currently reading?
Oh man, I'm not currently reading any. Although there's a series. It's called the Bryant and May book mystery series. He actually just put out the last one. It's by Christopher Fowler. I have it all over here, but it's this great. It's actually a really good mystery, and it's set in London, and it's these two like kind of old crotchety detectives, and you learn a ton of stuff about London, and there's a good mystery, and there's like hysterical dialogue. So that's probably one of my favorites.
Fantastic. So, well, we're all placing our orders on Amazon to order these series and these books. I want to say thank you so much for joining us, for giving us a little insight into one of what I think is possibly one of the best, most innovative ways to be helping people. So, thank you for the work that you're doing. Thank you for
Sure.
joining us today, and we look forward to having you back on the show.
Thanks so much for having me, Jen. Have a good one.
Thanks for tuning in to the Radically Transparent podcast brought to you by Oktopost, the only social media management and employee advocacy platform architected for B2B. I'm Jennifer Gutman, your host and director of social strategy here at Oktopost. And if you love today's show, we'd love if you subscribe, rate, and give a raving review wherever you get your podcasts. For more discussion on B2B social media marketing, be sure to follow Oktopost on LinkedIn. And of course, to gain access to all our free social media marketing and employee advocacy resources, head on over to our website, www.oktopost.com. Until next time.